Hi, it's Lori again. This video is about treatment-induced trauma and treatment-endorsed trauma. Treatment-induced trauma talks about a scenario or refers to a scenario where the woman cannot trust her husband anymore. You know, she's supposed to be able to depend on him most out of anybody in the world. She thought she was safe with him. After the betrayal, she realizes she's not, and so she turns to other places that are supposed to be safe. The church, the helping profession, 12-step groups. And when she gets there, they tell her things like, you're codependent, you're an addict as well, you need to work on your issues, you need to have more sex with your guy, this is your stuff, not his, you're being too controlling. You know, I've heard some horror stories of what women are told. Anyway, so then they prove to be unsafe too. Well, because she's in such a vulnerable state and because she really trusts these places, it can lead to a re-traumatization for her. And the problem is, if she gets misinformation, she can try to do that stuff for a long time, but if you've seen previous videos of mine, you know that sometimes if there's enough instances of her feeling completely unsafe, then her brain is not really, it may not have the capacity to do those things. So it can keep her stuck in spinning her wheels for years. Like me, I tried to not be codependent enough for him to be faithful to me in his mind, and it just didn't work. So that's what treatment-induced trauma is. Treatment-endorsed trauma is a term I came up with to explain this scenario. So imagine that a husband and his partner go to a therapist for this reason, or go to anybody for help for this reason, and the person they're going to, who is trusted to know about these things, in his presence tells her those things that I just listed. You know, you need to have more sex with him, this is your issue, not his, you're being too controlling, these are your codependent issues, those sorts of things. Once the guy hears the professional or the helping, the person in the helping position say that, it's very difficult for him to ever believe any different. Which is why my husband starts right off the bat talking about trauma and just saying, yes, this is about her trauma. I get it, you know, it's difficult, but she's been traumatized, you know, be patient with her, have empathy for her, that sort of thing. Much different approach. So, and again, the reason my husband does that is because a lot of these guys have gotten misinformation and really then kind of turn on their wives and are then endorsed to traumatize her further through the treatment that they've both received. So anyway, that's my explanation, or that's my take on those two terms.